This is Dr. Boyd. I'm going to show you how to set up a central line kit and also how to do a blind insertion of a right subclavian. Showing you the landmark. I have a wonderful person is assisting me with this. Obviously, we will not be inserting a central line in her. However, I will show you the landmark so that you are more comfortable inserting these central lines. So I have my kit right here available. Uh, I have my saline flushes that I've already emptied out here. I also keep everything that I will not need over to the side because I really don't want to injure myself and I want this to be as quick and safe as possible. I do not use a syringe just because it's more cumbersome than helpful. Uh, I have the 3cc syringe that I use for my lidocaine. I prepare all this prior to actually prepping the patient. This is my 3cc syringe, and I will have lidocaine in it. I switch over my needle, and I have a longer one that I can use right here. This one is ready to go. Again, this is my lidocaine in my 3cc syringe. This is my 5cc syringe, and this is where I have my normal saline, and I flush each port because it makes it less likely to have clots when I insert it. And I have another one here. So this is now flushed. My central line is flushed. And I put about 1 cc of normal saline in my syringe. And I fit it with my central line needle right here, ready to go, with easily removable needle. I have my needle driver here. I have my scalpel here and my dilator. And I also have my guide wire, and I try to see which direction it goes just to make sure that it will go caudad. So it's ready to go, loaded and ready to go. Everything else I do not need is off to the side because I don't want to injure myself and I want to make this as quick as possible. The drape has been fitted underneath so I can find it easily, as well as the dressing. So what I do is I put the patient in Trendelenburg with the head down so that I can more easily find the subclavian. I place my drape over the space. So this is the way that I find it is I go at the boundary between the pectoralis muscle and the deltoid. Right here is the boundary. And what you have is you have that space underneath, and you insert the center line right underneath, and you aim it toward the suprasternal notch. So this is my landmark. Again, I've got my deltoid muscle right here. I have my pectoralis muscle right here. And at the boundary is where I insert. I insert it so that it goes directly underneath and parallels the subclavian. I usually have the patient with the arm along the body, and even what helps is having an assistant who pulls down the arm towards the feet. It exposes it nicely. I insert my needle right underneath, and I have it aimed towards the suprasternal notch. So I push down, and it goes underneath the clavicle and it goes parallel. Okay? So this is my landmarks for finding the right subclavian, right here. Again, the deltoid, the pectoralis, the boundary. I go underneath and I push my needle down underneath the clavicle, make it go parallel underneath the clavicle towards the suprasternal notch. So when I place my drape, I make sure that the patient is comfortable. I let them know what I'm about to do, but I also place them on oxygen so that they have supplemental oxygen. I place my drape like this, and I expose that space nicely. I stretch out the drape, and what I like to do is I actually like to keep one fold in the drape, and this will have my guide wire loaded, ready to go. It's secured here, it doesn't move. I take a 4x4 here at the dependent area so that if there's any bleeding, it goes right here because the blood collects right in the 4x4. I put my finger, my index finger in a suprasternal notch. I have my thumb right here at the boundary. And what I do is I numb the space with my lidocaine in a 3cc syringe. And then I do not remove my fingers. My fingers stay in the same position. I take my needle, my 5cc syringe and my needle, and I have my needle with a bevel towards the feet. And I press down and I go parallel underneath the clavicle towards the suprasternal notch. At that time, I remove my needle, make sure that as soon as I access venous blood, I remove, I empty out, and I bring my guide wire is easily accessible, and I insert the guide wire and it comes out, and the curvature of the guide wire faces caudate. Once my guide wire is advanced to approximately the 20cc mark, I remove my needle and I leave my guide wire in place. I then take my blade and I make an incision right above the guide wire to almost the blue plastic. And then at this point, I still hold everything in place. I place my dilator over my guide wire, which at this point is at the 20cc mark, and it's with this part. And what I do is I apply pressure here so that my guide wire is never loose, is never alone, and I curve the guide wire. And at this point, what I do is I take the tip of my guide wire and I rest it over my finger and I guide it this way. I apply pressure, I advance, leave it there a few seconds, then I remove it and I continue applying pressure. This is still one hand. And then I take my central line and again I rest it on my finger and insert it easily. I never lose touch with my guide wire. Insert it inside. It comes out always out of the brown port. Because my clip right there is at the end, it's a one-hand procedure. And I push it through and I grab the guide wire, and at this point I advance my central line and pull it out. Pull out my guide wire. This is in place. Once this is in place, I aspirate each port with, and this is again one hand. I release, I aspirate, I flush with normal saline, and I reflux. I place the bio patch and then I place the proper caps on top of each one. Any other questions? Any questions, Dr. Munoz, Dr. Nozaki? No? No?
So are you applying, do you use your finger to press down as you insert your needle? Can you go over that again?
Yep, absolutely. So I have about 1cc and then I have my needle with a bevel towards the feet. And what I do is I have my finger in a suprasternal notch right here, and I have my thumb over at the boundary between the pectoralis and the deltoid, and I take my needle and I press down on my needle and I insert it so that it's parallel underneath the
clavicle and kind of helps you push it underneath.
Exactly, and aim towards the suprasternal notch.
Perfect, thank you.
Any other questions? All right, well, thank you very much. Thank you.